going on, all of my healthcare brothers and sisters? I hope that you are having a wonderful day. Critical care nurses are the backbone of PCU and ICU. Without us, it's kind of difficult to run, right? We have to be able to advocate for our patients, and in order to do so, we have to use assertive communication when we feel that something is wrong or we need clarification on something where we're not getting an answer. So in this video, we're going to discuss tips on how to use that assertive communication to your advantage in the critical care environment. So for those of us who might be new at using assertive communication, you might be wondering what it is and why it's really important. So assertive communication is the quality of being self-assured and confident without being aggressive. There's a big difference. It's the ability to stand up for oneself and one's belief while respecting the rights of others. Critical care nurses must be assertive in order to provide the best possible care for their patients and maintain their license. Very important. They may need to speak up to doctors or other healthcare professionals in order to ensure that the patient is receiving the treatment that they need. So assertiveness is really important in the critical care setting because it helps prevent burnout. Nurses who are able to speak for themselves and set boundaries are less likely to feel overwhelmed at work when they implement assertive communication. So what are the benefits of having assertive communication as well as an assertive attitude? Well, it can help you get what you need by communicating them clearly and directly. When you're being very aggressive, somebody else takes that personally and they tend not to respond as well. Versus when you use assertive communication, you're able to speak clearly and directly about the things that you need without the need to become aggressive or emotional. You can also stand up for yourself as well as others. This is that huge thing about advocating for your patient. If you're able to advocate for your patient when you feel that something is wrong and you're not getting the answers that you need from the provider or whatever other healthcare professional that you are speaking to, assertive communication can help you get your point across. You can also set boundaries. I think that's the biggest thing that we lack sometimes as nurses is we don't have a good set of boundaries. You know, sometimes you'll get a phone call and they'll say, oh, we're short-staffed, we need you to come in, and now you're working 6 days that week as opposed to 3. So really setting those boundaries with your workplace, with the colleagues and the people that you work with is ultimately going to be very beneficial, not only for them, but also for your mental health. We talked about communicating more effectively. That is absolutely 100% a given when it comes to using assertive attitudes as well as communication. It'll also help you with handling conflict because if you're using a non-aggressive way to communicate with somebody regarding a conflict, it ultimately will help you get your point across and you might even be able to come up with a resolution to the issue. Say, for example, you are working with another colleague and that colleague always asks you for help, but the times that you ask them for help, they don't want to help you. So sometimes you might have to have a conversation with somebody and say, hey, I understand that you're busy. We're all absolutely busy. I really truly need your help in this situation. What are the barriers that are preventing you from being able to help me? Because as you know, I always help you. What I will say with that is not when you help somebody, don't always expect something in return. But if it does become a pattern, a repeating pattern over a long period of time where you are absolutely helping somebody whenever they need help and then you need that help and they're not helping you, that is when I would start having those conversations and handling those difficult situations using the assertive communication method. It also helps you be more confident, right? You, as nurses, we really truly have to be very self-confident in the way that we speak and the way that we communicate with other people. So being able to use assertive communication versus any kind of aggressive or a passive communication, it really truly helps kind of elevate us to the top of our practice, and it actually makes us feel good inside. It helps with that mental that we were talking about before. And then lastly, reduce burnout. When you set boundaries and you use that communication effectively, burnout tends to be a lot less. If you're always that yes person, always that, yeah, absolutely, I'll do that. Oh, no worries, I'll do that. Yeah, I'll come in on my days off. You tend to get burned out really quickly. You can absolutely be a yes person, but you have to set boundaries around your yes. And we do that with assertive communication and an assertive attitude. So next we're going to take a closer look at what are the differences. How do we respond differently based on aggressive, passive, and assertive communication? So as we said before, there are major differences in regards to aggressive, passive, and assertive communication. It's truly important to be assertive in your communication as you're going to get the best results with the parties that are involved with you. So starting with aggressive responses. In this one, you are responding with some kind of hostility or force. You never want to respond that way. This type of response is usually a result of feeling threatened or maybe even you feel attacked. It is important to avoid an aggressive response as it can only escalate the situation and ultimately make it worse. So for example, an aggressive response would be, absolutely not. This is the last favor that you're going to ask of me. You need to learn to manage your time instead of asking me to drop everything to help you. See how aggressive that conversation got? You're probably going to feel very attacked by that person's hostile way of communicating with you. This is only going to serve to make that situation much more tense and could lead to further conflict, in which you do not want. So then we also have passive response. And this is when you do not express your needs or wants, right? You just passively kind of say, yeah, sure. This type of response is usually a result of feeling powerless, or maybe you even feel unworthy. And I will tell you, you work too damn hard for your nursing license to feel unworthy in this career. Don't let anybody put you down, period. It is important to avoid a passive response as it will allow the other person to control the situation. You don't want somebody else to control the situation when you're having some kind of conflict. So an example of passive response would be, I don't know, whatever you want to do is fine with me. This response gives the other person the power to make decisions for you that may not be in your best interest. You don't want to use aggressive communication and you don't want to use passive communication when it comes to your professional practice. So assertive responses. This is the one in which you express your needs and your wants in a calm and direct manner. This type of response is usually a result of feeling confident and self-assured. Because as we know, we're extremely confident within our career, we're extremely confident within our practice, and confident within ourselves, right? This is why we got into nursing. So it's important to be assertive with your communication as it will result with the best possible outcomes for everybody that's involved. So an example of an assertive response would be, as much as I would love to assist you, I have a lot of errands that I need to complete today. I do hope that you're able to find help for your situation. This response expresses your needs in a clear and direct manner while still respecting the rights of the other person. By setting boundaries, you're not only helping yourself, but you're also helping that other person. So please, when you have the availability to do so, always use this assertive communication. You don't need to argue your point. Your point is unarguable. You need to find a resolution, and this is what you're going to do in order to help yourself as well as help them. So you might be saying to yourself, Nurse Cheung, I appreciate you giving me some examples, but I still don't know how to be assertive in my professional practice. Well, here's some additional tips to help you with your assertiveness. If you're not used to speaking up for yourself, it can be difficult to know where to even start. So with tip number 1, you want to start small. If you're not used to being assertive, it's important to start someplace small. Begin by practicing assertiveness in low-stakes situations, such as asking a friend for a favor or telling a coworker that their behavior is bothering you. Tip number 2 is to pay attention to your body language. Your body language can be just as important as the words that you use when you're communicating. When you're speaking, make sure to maintain eye contact as well as an open posture. This will help you to appear confident and assertive. If you approach somebody like this and you're looking up with your eyes, do you think that that person is going to respond very well to you? Probably not. If you come up to them like this, with your eyes big, it's also going to be very hard for somebody to communicate with you. So if you approach somebody, you maintain eye contact, and you have an open posture, meaning you're not crossing your arms, this allows for that person to perceive that you're ready to have an open communication. That's a huge tip when it comes to being assertive with your communication. Body language is huge. Tip number 3, use I statements. When you use you statements, it's a little hard. So if you use I statements, it gets the point across a lot better. For example, instead of saying, you need to stop interrupting me, you can try saying, I feel disrespected when you interrupt me. You see how it takes the focus off somebody else and puts it back on yourself? That's what we're looking for. So with the use of I statements as opposed to you statements, you take the power back, right? They no longer have the power. You are taking your power back by expressing how you feel and why it concerns you. Tip number 4, practice assertive responses. It can be helpful to practice assertive responses to common situations. This way, you'll be prepared the next time someone tries to take advantage of you or dismiss your concerns. So for example, if somebody asks you to do something that is outside of your scope of practice, you could say, I'm uncomfortable doing that as it is outside of my scope of practice. You're voicing your concern, you're uncomfortable, and you're voicing why. Because it is outside of my scope of practice. There's no reason to get aggressive and no reason to get passive with that communication. You are simply explaining to them, I am concerned because it is outside of my scope of practice. No questions need to be asked after that, right? Tip number 5, get to the point and keep it simple. In the heat of the moment, it can be tempting to try to justify your position. How many times have we been in that situation? I absolutely have been in that situation where I feel like I have to explain why I feel the way that I feel. You can even give long-winded responses because you're trying to explain and justify your position on a certain situation. You do not need to provide any justification to your boundaries. They're your boundaries. This will only make you appear defensive as well as uncertain. Instead, focus on keeping your responses short and to the point. They don't need your justification. They just need to know what's going on with you and why. I'm concerned. This is outside of my scope of practice. Period. Tip number 6, setting boundaries early. This is so important, especially as you're now transitioning within your career. Boundaries are going to be huge. And early on, before you have the chance or I should say before anybody else has a chance to take advantage of you, set those boundaries. So for example, if you know that you do not want to work overtime, I'm a huge component of not working overtime. I am going to work the time that I need to work, and then I'm going to go home and enjoy my days off because those are my boundaries. You want to make this clear from the start. You can firmly and politely, remember, be firm but also polite, and say, please do not call me on my days off. This is my personal time, and I don't want to work outside the hours that are set in my job description. If your job description says you work 36, I work 36. If my job description says I work 24, I work 24. I am asking you to please not call me on my days off, as this is my personal time, and I do not want to work outside the hours set in my job description. Period. This way, you will not be placed in a position where you have to choose between your personal life and your job. That should never be an option, right? We need to have work-life balance, and that is how we achieve it. If you're the type of person who wants to work every day, then you're more than welcome to, right? But if you're the type of person like me who likes to have that workplace balance, as well as my personal balance, that could be one way for you to set boundaries early within your career. So tip number 7, don't be aggressive or raise your voice. You always want to speak in a neutral tone. Assertiveness is not the same as aggressiveness. We talked about that before. When you're assertive, you're able to stand up for yourself without resorting to put downs or having to raise your voice. None of that needs to happen. Instead, focus on speaking in a clear and neutral tone. This will help you come across as confident and in control. So for example, instead of saying, you're wrong, remember, we don't want to give them the power. We don't want to use those you words. We want to try saying, I disagree. Right? Do you see how you take the power back? I disagree with your statement. I disagree with this. Okay? Big, huge when it comes to assertive communication. Tip number 8, actively listen to what others say and respect their opinions. You're going to have to listen to other people's opinions. Whether you agree or disagree with them, you still need to be polite in regards to other people's opinions. Just like you can have yours, they can have theirs as well. So when you're in a discussion, it's important to actively listen to what the other person is saying. That doesn't mean that you have to agree with them, but it's important to respect their opinion. And you can do so by paraphrasing what they've said and acknowledging their points, but that maybe you disagree. Again, I disagree. I hear that, this point, blah, 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 blah. However, that is not something that I agree with. Period, right? It ends the conversation. It allows you to have the power back by using those I statements. So tip number 9, ask questions to understand the other person's views that are different than yours, right? We want to be respectful of their opinions, but we can also ask questions to understand why they have that specific viewpoint. That is how we have a productive discussion, is by understanding other people's points of view. You can do this by asking questions about their opinion. So for example, can you explain why you feel that way? Or what would you do in my situation? That's those asking questions to understand other people's opinions. Tip number 10, look for areas of compromise and know your limits. Not every situation can be resolved to your satisfaction, unfortunately. In these cases, it's important to look for areas of compromise. So for example, if you're negotiating with your boss for a raise, I think we could all use that right now, right? You may not get exactly what you want. However, you may be able to compromise by asking for a meeting to discuss the possibility of a raise for a later date, at which time you can do market research for your position and have evidence to provide if you are falling below your value. It's also important to know your limits and be willing to walk away from the situation if it's necessary. Never feel guilty for leaving your coworkers or leaving your workplace. If you feel that you are not getting paid the money in which you feel that you provide to the company, if you feel you provide a lot of value to the company, but you're not getting paid in reflection to that value that you're providing, then you absolutely can walk away from a situation if it is necessary. I myself held on to a job for far too long in a previous position because I felt guilty for leaving my team. Never feel guilty for leaving your team. They are going to replace you just as quickly as you left. Okay. So you can still maintain friendships outside of work. However, it doesn't necessarily mean that you need to maintain that employer-employee relationship. And then lastly, tip number 11. Then we have 2 more tips. Tip number 11, learn how to say no assertively. I think that's the biggest one, is we're always scared to say no. This is one of the most important assertive skills, is having the ability to say no when you need to. It can be difficult, especially if you are a people pleaser like me. However, it's important to remember that you cannot please everyone all of the time without sacrificing some part of your mental health. When you're presented with a request that you're not comfortable with, you can say no by using one of the tips above. So for example, you can say, I'm sorry, but I'm not comfortable doing it as it is outside of my scope of practice, right? I think the biggest thing in healthcare is we use our cuss words. So I'm uncomfortable, I'm concerned, this is an unsafe situation. If you usually lead with one of those 3 things, it kind of makes the other person go, oh, okay, this person's not feeling comfortable. And then you can start discussing the barriers as to why you feel uncomfortable. But again, you don't need to justify the reasons why you feel uncomfortable if you don't have to. At the end of the day, you're uncomfortable, and that's what it comes down to. And then lastly, tip number 12 is always to maintain eye contact. When you're speaking to someone, it's important to maintain that eye contact because it shows that you're confident and you're engaged in that conversation. It can be difficult to do, especially if you're shy or very introverted. I'm very introverted, and it took me a long time to get that eye contact situation down. However, it's something that can be practiced with time, and it'll ultimately help you when you're having conversations in which you have to use assertive communication. So let's take a look at a few examples of when you need to use assertive communication in critical care. One of the big ones is nurse to physician communication. This can ultimately be difficult, especially when the physician is new or are set in their ways in regards to their communication. However, it's important to be assertive with physicians in order to provide the best care for your patients. So below are a few examples of how you can use assertive communication with physicians. Number 1, I understand that you want the patient to be transferred to PCU. However, I do not think that is the best interest at this time. The patient is currently unstable, and I think that they would benefit from remaining in the ICU for close monitoring. You provided the fact that you're concerned. You are taking that, right? You're taking the power back. I understand. I'm not pointing fingers at the physician, and I'm stating why this patient probably should stay in PCU. I'm providing medical facts as to the reason why they would probably benefit from it. Number 2, I understand that you want to start the patient on a new medication. However, I am concerned with the potential side effects. Can you please explain the risk and benefits of this medication? This was huge, especially during the COVID pandemic, where we had new medications coming out all the time. And as nurses, we didn't necessarily know those medications because they were brand new or they were just created. So it's always good to ask the physician or the provider, whoever's ordering medications that you're uncertain with, to just get some clarification about what the risks and benefits are, especially if it's like experimental medication, because you truly need to know what to look out for with your patients. And then tip number 3. I understand that you want to discharge the patient today. However, I'm not comfortable doing that as the patient is still unstable. I think it would be in the best interest of the patient to remain in the hospital for at least one more day. This happens a lot. This probably should have been something that we discussed during legal and ethical issues, but sometimes in addition to the patients being unstable, is maybe they have a situation that they can't go home to. So sometimes you have care providers that probably need care themselves, right? And you can't discharge somebody to a care provider who's not going to be able to provide the care that patient needs. And that's difficult conversations that you're going to have with providers and physicians or whoever the case may be to advocate for them so that you know that you're sending them to a safe situation so that they can recover. Sometimes they have to go to assisted living facility for a little bit. Maybe sometimes they even have to go to a skilled nursing facility. It's hard to say, but if you use assertive communication and you express your concerns as to why this discharge is unsafe, usually everybody pretty much gets on board and they look for other alternatives for your patient. So the next communication style we're going to look at is nurse-to-nurse leader communication. This can also be difficult, especially when you're requesting time off. I feel like time off requests shouldn't be that difficult, but sometimes we have to have those conversations, or when you're requesting a raise. However, it's important to use assertive communication when you're communicating with your nurse leader so that you can get your point across as to what you're concerned about and why, right? So one example could be, I am sorry for the short notice, but I'm requesting to take tomorrow off. My child is sick and I need to stay home with them. There's no further discussion after that. You need to take the time off. You are giving them ample time to find a replacement for you for that day so that they can look for other nurses that maybe can come in that like to work overtime, right? But you are providing them with, you're going to be out sick and this is the reason why. There's no further discussion, period. Another example. I know you are busy, but can I please grab 5 minutes of your time to discuss my recent performance review? Again, huge. A lot of times, having worked as a nurse leader myself, there's so many things that we are having to do administrative-wise, making sure that the unit's okay, making sure that we're meeting budgetary guidelines that are set by our organizations. There's so much that we do that we forget about the employee, right? We forget about our teammates. So using the phrase, I know you are busy, usually helps kind of reel nurse leaders back in to go, wow, I really haven't checked on my employees today. Only if you have a good nurse leader. Not all nurse leaders are great. Some nurse leaders have areas of opportunity in which they can grow, as well as provide resources for their employees. But this is something absolutely that you can use in regards to communication with your nurse leader and just saying, hey, I know you're busy, but I really want to spend at least 5 minutes of your time having a discussion about my performance review, especially if it's not congruent with the way that you feel like you're providing care. If you have a poor performance review, and you know that you've been doing very well, you might want to have that discussion. But that's one way you can start that discussion. Another one is, I am interested in taking on leadership responsibilities. Can you please let me know of any open positions or upcoming projects I can be a part of? So sometimes, as a new ICU nurse, new critical care nurse, you might actually want to step into a charge nurse role, or maybe you want to look into becoming an A&M, an assistant nurse manager. Maybe you even want to become a nurse manager one day. Depending on your organization, sometimes they have resources to help get you there. But the first step to letting the organization know that you're interested in more leadership opportunities is to actually have that conversation with your leadership, right? This is one example of a sentence that you can use in order to open up that communication. That's assertive. And then lastly, I would like to discuss the possibility of a raise. Can we please schedule a meeting to discuss this further? It's probably not the best time to have this conversation about a raise when you're taking care of patients, right? Maybe you need to have this conversation after a shift or before a shift, or maybe you need to even come in on your day off. Maybe it needs to be a phone call, whatever the case may be. Probably not the best time to do it when you're working. However, you can always, like I said, schedule a meeting to further discuss this matter. So that way you can sit down with your leader, have a conversation, discuss your value, discuss what you are providing to the company that is so valuable, and why you feel like you need a raise. And if they don't provide the raise to you, you're always welcome to look for other opportunities. I don't want anybody to ever feel like they are stuck in their career if they feel that the monetary value that the company is providing you is not meeting the value that you are providing to the company. Okay, never feel bad about leaving your coworkers. At the end of the day, they will replace you. So you need to go someplace that you feel valuable and that's going to pay you for your efforts. Hopefully that helps kind of clear up a little bit with that nurse to nurse leader communication. Another common form of communication that you're going to have is nurse to nurse or nursing partner communication. This can also be difficult, especially when it's your colleagues and you need their help, but sometimes you need to have these conversations. Some examples can be, I know you are busy, but can I grab 5 minutes of your time to discuss my patient's care plan? This could be you having a conversation with your charge nurse, right? So sometimes, the initial care plan that you maybe discussed earlier in the day has completely changed because of the patient's change of condition. So sometimes you're going to have to reel in your nurse leadership in order to help you provide this care for this patient. That's one way to start that conversation. You can also say, I know you're new to the unit, but can I ask you to double check the medication doses before giving them to the patient? I want to make sure that we're providing the best care possible. This happens a lot. Medication errors happen a lot. Sometimes you have to have that difficult conversation with people, especially as a charge nurse to a nurse, right? I notice that the patient's blood pressure is dropping rapidly when they are receiving this medication, where if given appropriately, it shouldn't be dropping rapidly. So having that conversation, and again, using those I statements instead of pointing fingers and saying you're doing this wrong, just saying, I know that you're new to the unit. Can I please ask you to do this? Completely changes the way that the conversation goes after that. And then lastly, I understand that you are the charge nurse, but I do not think it is appropriate to shout at the nurses on the floor. Can you please discuss a different way to handle these situations? Whether it is a charge nurse, a physician, somebody at some point is going to yell at you. It's just a fact of just nursing in general. I think it's really just a fact of careers in general that somebody is going to yell at you at some point. Again, using those I statements. I understand that you are the charge nurse, but I don't think it's appropriate to shout at the nurses on the floor. Instead of saying, you need to stop shouting at the nurses on the floor. You see how that became very aggressive? It's using those I statements. Can we please discuss a different way to handle those situations? Maybe they need to pull them into a room and have a discussion. Maybe they need training on how to be assertive when they're communication as opposed to being aggressive and being hostile and shouting at people. It's ultimately our responsibility. If we see something wrong, we say something, right? If you see something, say something. It's the same situation. And that's kind of what's happening here with nurse to nurse communication is sometimes you're going to have difficult situations where you're going to have to discuss things that are probably uncomfortable to discuss with other nurses. But with using assertive communication, you take the power back by saying, I feel uncomfortable. I'm not sure about this. I don't know this. If you take it upon yourself, as opposed to pointing fingers and being aggressive with somebody else, it's really going to help lead the conversation to hopefully a resolution. Sometimes it doesn't. Sometimes you have to follow your chain of command to seek resolution if you can. But most of the times when you're using assertive communication, it ultimately helps drive the conversation in the right direction. So the last form of communication I want to discuss is Preceptee-to-Nurse communication. That is you who is orienting to the person that is orienting you. This conversation sometimes can be very difficult because you don't want to be perceived as difficult to work with. You don't want to be the person that causes trouble being new to the unit. You don't want to be perceived negatively in the eyes of your coworkers. So sometimes having those conversations can be very difficult in really any kind of capacity within the healthcare system. But hopefully these tips will help you in regards to that communication. So one of the ways you can communicate is to say, I understand that you want me to do a certain task. However, I don't feel comfortable doing it as I'm not familiar with the process. Can you please walk me through it? Again, instead of saying, you need to stop assigning these tasks to me because I have no idea what the heck I'm doing, which is what we usually say, right? Is using that assertive communication and saying, I don't understand what you want me to do. However, I do not feel comfortable doing it as I'm not familiar with the process. Can you walk me through it? Takes the power away from them, gives it back to yourself, and helps you advocate for yourself so that you're not performing a procedure that can hurt somebody. Another example is, I understand that you want me to take care of the patients by myself. However, I'm not comfortable doing that as I'm new to the unit. Can I please have a nursing partner to help me with this? That's going to be huge. So a lot of times when you start orientation, depending on where you're working, they start assigning you patients independently, right? Because they assume that you're going to have some kind of general knowledge. And sometimes not all preceptors want to be preceptors. Let's be completely honest. So when you start in a new career, sometimes you might be paired with somebody who doesn't necessarily want to precept. It happens all the time. I want to be very transparent and straightforward with you when I provide my education. Sometimes you're going to be assigned to somebody who did not want to precept you to begin with. And when that happens, a lot of the times, not all the times, but a lot of the times, that particular nursing preceptor is going to assign you patients and have you working independently on procedures and things that you don't understand. And that's when you need to have a conversation. Before you go to leadership and you tell leadership that there is a problem, try to mitigate that conversation between you and the nursing preceptor. Maybe it's that they're having a really bad day. It's not that they don't necessarily want to not precept you, but maybe they just have some personal things going on at home and they don't realize that they're taking it out on you. Or maybe you're in a situation where you have different communication styles. Maybe you learn by being very tactile, whereas that person learns as being very visual, where they write things down. If your learning styles are very different, that can also be very difficult, and that sometimes causes a lot of animosity between people on the unit because they don't know how to effectively communicate in regards to what the problems are. That's where I come in as a nursing educator so that I can figure it out. But in the meantime, you can still try to mitigate that before you go to upper leadership and then start having a discussion of, this really isn't working. I'm not 100% sure what I can do on my end. I don't know what the barriers are. I'm open to any feedback or constructive criticism about my working and my practice. However, I don't feel that I'm going to be successful in the current situation that I'm in. Do you see how I took that entire conversation and used I statements? I took it upon myself saying, I'm concerned. I want to make sure that I'm successful, right? And then the last one is, I understand you want me to work overtime. However, I am not comfortable doing that as I have already worked a 12-hour shift. Can you please find someone else to cover the overtime? Do not feel like you are forced to work overtime. Unless you're working in some place which has this mandatory overtime requirement, which I think is ridiculous. But if you are working someplace where they're mandating that you have to work overtime and that is not something that you want to do, you might want to look for a different profession that closely meets the needs and the values that you have for yourself. Remember, we talked about setting boundaries. If the organization that you're working for does not support the values and the boundaries that you have established for yourself, then you might have to look for someplace else that will provide you with the things that you need in order to not compromise yourself, your boundaries, as well as your values. Hopefully that was very helpful in regards to different communication styles with different people that you're going to have on the healthcare team. I hope that this video was helpful in understanding assertive communication as well as how to set boundaries for yourself when it comes to the healthcare profession. As always, if you have any questions, make sure that you leave them down below. I love answering your questions. Also provide me some feedback on some situations that you've been in where you've had to advocate for yourself. Head over to my website at www.nursecheung.com where there's a ton of additional resources for you in transitioning within the critical care environment. And as always, I will check you out in the next video. Bye.